Good day, ladies and gentlemen, dear friends. My name is Vasil Rohovyy. I am a hand transplant patient from Innsbruck, Austria, and the founder of the VCA patient organization, the Voice of VCA Patients. Welcome to the interview. Today, our guest is Professor Gerald Brandacher, Scientific Director of Reconstructive Transplantation Program at Johns Hopkins University School of Medicine, Co-Director and Executive Vice Chair of Research at the Department of Visceral Transplant and Thoracic Surgery at the University Clinic of Innsbruck. Professor Brandacher is board member of the main transplant societies such as ICVCS, ISRT, ESOT, and many others. He is one of the leading experts in advancing translational research and clinical application of VCA, and actively involved in surgical and immunological development of VCA worldwide. Professor Brandacher is a key member of the scientific board of the Voice of VCA Patients. Let us talk to a person who has dedicated his life to transplantology. Good day, Professor Brandacher. Nice to see you.
Good to see you, Vasily. Thanks so much for having me.
Thank you very much for your time. Professor Brandacher, I would like to start our conversation with the question, how has your medical journey begun? And why did you choose transplantology as your specialization?
So my transplant journey has begun, well, as long as I can remember. I always wanted to go into surgery. That was a dream since early days in school. Eventually, I had the good fortune to went to medical school at Innsbruck Medical University. And there I got exposed to the very prominent transplant program that was ongoing or is ongoing at the University of Innsbruck, and met my future mentor, Professor Raymond Margreiter. He got me involved in transplant as a medical student, and I was immediately fascinated by the field in how profoundly transplantation can alter a patient's life. With a single surgical procedure, you can have a patient that with terminal organ failure and transform these patients into a patient that is healthy and vital and active again. And this to me was just striking and profound, and has really sparked the fascination in this field. And that's how I ended up then pursuing transplantation as a career.
Thank you, Professor Brandacher. As far as I know, you were trained in kidney and liver transplantation. And it would be very interesting to know, how did you get involved in the hand transplant program at the Medical University of Innsbruck? Why did you decide to take the job?
Yeah, again, I think as so often, you need to have some luck when choosing your career and to be at the right place at the right time. And I think that is what exactly happened to me. I trained in Innsbruck when we performed the world's second double hand transplant ever performed. And at that time, as a young transplant surgeon, I was again fascinated by the impact that this procedure can have on a patient's life. And I felt, well, this is the dawn of a new era in transplantation. And I did everything that I can to be involved in this type of procedures, read up on this field and involved myself also in research in this area. And this is how I got involved in reconstructive transplantation.
Professor Brandacher, you are one of the leading experts in VCA, not only in Austria, but also worldwide. And could you explain to our viewers in simple terms, please, what VCA is and what its goals and mission is?
Yeah, I'm happy to do so. Unlike solid organ transplantation, VCA is a non-life-saving type of transplant, but it is a life-changing type of procedure. The main goal of VCA is to replace like with like and to restore both form and function in patients that have had devastating tissue loss, which means they have had either amputations or other severe type of injuries that led to the loss of tissue or body parts that cannot be reconstructed with any conventional type of surgery. And here, transplantation offers uniquely the ability to replace like with like by taking this body part from a donor and then transplanting it and thereby restoring form and function. And this is what VCA is all about. And I think it can have a transformational impact on a patient's life in this regard.
Professor Brandacher, in your opinion, what new developments in the field are the most promising? And how would you assist the present state of scientific research in the field? Is it moving forward or slowing down?
I think there's a lot of really exciting things going on at the moment in transplantation. If you will, I think we are again at the verge of a new era in transplantation, especially in the area of organ preservation that really has limited transplantation for many, many decades. We only had a few hours of time between organ recovery and transplant. But now with new preservation technologies, such as machine perfusion or new advances in cryopreservation, we can actually extend this short time frame of organ preservations from hours to several days. And this impacts every aspect of transplantation. We can better match organs. We can hopefully provide more organs to patients in need because we can utilize a larger donor catchment area. We can implement new treatment strategies because we can pre-treat the recipient, and many, many more aspects in transplantation will be profoundly changed. So I think this is one area that is extremely encouraging. We also see a lot of advances in the field of immune modulation and immunosuppression, new type of therapies involving cell-based therapies that help us to reduce the side effects and toxicities of long-term immunosuppression. I think there are new protocols evolving that will really change also the way how we treat patients long-term. The requirement of immunosuppression will potentially change. This, again, in combination with the machine perfusion technologies, where we can also now treat the graft outside the body and the recipient at the same time. This opens up a whole wealth of new possibilities to fundamentally change how we perform transplant currently. So I think, and then there's obviously other areas in the realm of xenotransplantation that is currently moving forward, and many, many other aspects in transplantation, so that I think science is dramatically moving forward. It's also impacting VCA on many, many levels. Unfortunately, the clinical cases are somewhat lagging behind. We have a lot of research going on, a lot of advancements in these areas, but we are not really transplanting, I think, enough patients clinically. And the reason for this is that we are still working through the challenges of getting payment for these type of procedures and reimbursement from insurance companies. There has been some progress, and I think we are moving in the right direction, but this, I think, is a hurdle that we have to overcome in order to really open up this field widely to a wide range of patients.
Yeah, Professor Brandacher, you held a very high position as ICRT president, and you have worked in widely known transplant centers like UPMC in Pittsburgh, John Hopkins University School of Medicine, University Clinic of Innsbruck, and you helped to build up various VCA programs in many other clinics. It would be very interesting to know about the most significant VCA programs you have taken part in, and what projects are you focusing on now?
Yeah, I had the privilege to be involved in several successful VCA programs, as you mentioned, in Innsbruck, then at the University of Pittsburgh, as well as at Johns Hopkins. And in this role, also, I had the opportunity to help other centers establish their programs. I was fortunate to work with the University of Pennsylvania, with Scott Levin's group, with Bo Pomahak's group at the Brigham, Cody Asari and Sue McDermott's group at UCLA, and several other centers in the US and in Europe. And this is one of the nice things about reconstructive transplantation, that it is still a fairly small field and that we know each other well, and that it is a very collaborative community. We are all breaking new ground, and we all have to work together collaboratively to really move forward and improve both the science as well as the clinical care for our patients. And it's just a privilege to be part of this, and hopefully have had a small impact on moving this field forward.
Professor Brandacher, I meant you have taken part not only in the hand transplant program, but in other VCA programs, maybe uterus, abdominal wall, or any others VCA programs. Could you tell us in which programs have you taken part in?
Yeah, so we have established, in addition to an upper extremity and hand transplant program, as well as a face transplant program, also a urogenital transplant program, where we performed the world's first entire male genital transplant several years ago in a young wounded warrior. This was a very, very rewarding program to see that we can again have this transformative impact on a patient's life. And we have learned lessons from hand transplant, where we've really shown that you can actually replace both form and function. And this was a patient with a type of injury that had no other possibility to reconstruct that defect. So we felt if we can develop a uniquely designed operative plan and a unique developed surgery, we could use transplant again to restore this defect. And this was successful. The patient is doing very well now, several years after transplant. And I think the biggest compliment that anyone could get is that the patient refers to himself as whole. And I think this brings us back to what is the purpose of VCA. I think it's this restoration of body wholeness, and then giving patients independence and autonomy back, that they can live their lives in a productive and active way. I think this is what the field is all about and what it can actually accomplish.
You are a pioneer of the intercontinental collaboration between Johns Hopkins University School of Medicine and University Clinic of Innsbruck. Could you tell us about this collaboration? What are the goals of this collaboration, and what results have you and your colleagues have already achieved?
Yeah, I think transplantation or research in general is a team sport. You have to work together. You can't do it on your own. I think if you build a network, and if this network is actually based internationally, that can help with a lot of initiatives to be really creative and innovative. And this was the goal why we wanted to expand our research program to be based in both at the University of Innsbruck and at Johns Hopkins. And we have actually started now using some of the research that we have done in organ preservation and applying it to real-world scenarios. For example, we are transporting organs from one institution to the others with a commercial aircraft, and are able to show that the research results that we are accomplishing are not only working in a lab environment, but can have a real impact in the real world and hopefully benefit our patients very soon.
Thank you. Professor Brandacher, we all have heard about scary side effects of immunosuppression therapy. And of course, I have to ask you this question too. How dangerous is side effects are side effects of immunosuppression therapy. And what is immunosuppression therapy really? What is about? Could you tell us about that too?
Yeah, so immunosuppression is needed in transplantation to prevent your immune system from recognizing the graft as foreign. This is what our immune system is built up. It's constantly distinguishing between self and foreign, and nature did not foresee for transplant to happen at some point. So we need to kind of suppress the immune system to prevent it from reacting against this new body part or this organ. This is done with several medications that a patient after transplant has to take for the rest of their lives, or as long as the transplant is present. In general, there has been a lot of improvements with immunosuppression. It has a very bad connotation, I think, from the early days where there were side effects were quite severe. Now I would say that modern immunosuppressive regimens are fairly well tolerated, especially if patients are compliant and really adhering to their regimens, if they get regular blood draws to adjust the medication and the dosing on a regular basis. They are very well tolerated, but of course they are not without side effects. They lower or they increase your risk for infections. Eventually, in the long run, increases the risk to develop certain kind of cancers, especially skin cancer, if taken for many, many years, and others. But it's like everything in medicine, it's always a trade-off. I think you have to balance risks and benefits. And I think when you look at the benefits of a transplant, either a solid organ transplant or a reconstructive transplant, against the trade-offs of side effects of long-term medication, then I think it is in favor of going forward with these type of transplants. Having said that, obviously, we are constantly striving to improve immunosuppression. That's a main part of our research. Ideally, we want to make them better tolerable. We want to reduce the dose and the number of immunosuppressive agents, and hopefully sometime in the future be able to induce what is called immune tolerance, that you could actually withdraw all medication and enable patients to live with a transplant without the need for long-term immunosuppression. And there are a lot of really promising developments in this area, and something that points us in the direction that this can become actually a clinical reality in the not too distant future.
Great. Professor Brandacher, you supported the creation of very helpful and useful web sources such as Within Reach, Give Hope, Give Opportunity, and establishing of our VCA Patient organization. How do you think is the level of awareness in the society about VCA enough? Is society really well informed about opportunities that VCA is able to provide for patients, or it is necessary to continue raise awareness about VCA? And how do you think could the above mentioned VCA sources and the activities of our patient organization play any particular role in raising awareness about VCA?
Yeah, I think there can never be enough awareness and education on a certain topic, especially something so critically important as transplantation or VCA. I think there's still much to do with regards to raising awareness in the public about what VCA can accomplish, what it means, what it entails, on both sides, the recipient side or the patient side, as well as on the medical professionals and the provider side. I don't think that everyone in medicine or every doctor knows enough about the potential of reconstructive transplant. So there's still a lot to learn, and I think initiatives like the ones that you mentioned are extremely important to provide this information, to raise awareness, and also raise awareness, I think, especially when it comes to organ donation, because it is extremely important to raise that awareness, to inform everyone about these type of transplants, to be able to generate enough organs that we would need to serve every patient in need. And this is something that really the entire field of transplantation needs to work on, that we educate the public about the benefits of organ donation, as well as the outcomes that can be achieved after transplantation.
Professor Brandacher, last question. You work not only as a scientist and surgeon, but also provides VCA patient and patients with solid organ transplantation with post-transplant care. The level of commitment you have taken on is really impressive. But I would like to ask you, what are the most regarding aspects of your work, and what keeps you motivated, and what helps you to discharge, to relax from all pain and suffer that you see every day in your work? Maybe it is a little bit private question, but if you can answer, it would be great.
Yeah, I think it's really, it is a privilege to work in this field. And I think to me, the most rewarding aspect is to see the impact that we have on a patient's life. In solid organ transplantation, to restore a patient's organ function, to see patients really walk out of the hospital with a functioning organ and then be able to live an active and independent life. And in VCA, it's the same, to really see that we can restore autonomy to patients. Patients who have had devastating injuries, who lost both arms, who lost parts of their face, to be able for these patients to be active and go out and live their lives again. That's the most rewarding in our field. And it's truly a blessing and a privilege to be able to be part of this endeavor.
And what helps you? How do you relax? How do you discharge from your work, so to say? What are your hobbies?
I like to be with my family a lot. So whenever there is time, I like to spend time with my kids, with my wife, and with our dog, to go out into nature, obviously to travel with them. We really enjoy traveling and see new places. But when you enjoy what you're doing, it's actually not so much that you need to get out of it and relax. So it's a privilege to find something that really fulfills you and that you like doing every single day. And that's, for me, the life in transplantation.
Professor Brandacher, thank you very much for this insightful and educational conversation and supporting our patient initiative with your talk. I wish you all the best in your difficult work, and have a nice day. Take care.
Thank you so much. Thanks so much for having me, and thanks so much for everything you do with regards to patient advocacy. That's extremely important and greatly appreciated. Thank you so much.
Thank you.